A common question that I get asked is whether I feel screening blood work is worth it, and at what age should a person actually start doing screening blood work. To answer the first question, I am very much in the camp of doing screening blood work. So many things in life are easier to prevent and address before the wheels come off. When we are able to identify a disease process early in the course, often before symptoms begin to show, we are going to be that much further ahead with trying to actually affect change and our outcomes. As to the question about timing, typically I start at least yearly blood work when my dogs are in the 5 ballpark. With that being said, I'd almost assure you that I've yet to own a dog that didn't cause me to do blood work prior to 5. Whether that be because they had vomit and diarrhea issues or had to have anesthesia for some reason. So from a screening standpoint, I'd throw 5 out there as a generic number. With most dogs, we have taken a peek under the hood prior to that time. From 5 until about 10, I'm pretty content with once a year monitoring as long as we haven't found anything. Then from 10 on, based on the dog, at some point I'll usually end up switching to every 6 months. With a fit athletic dog, that may not occur until a few years later. With a dog that has been on chronic meds or has other health issues, it will be closer to 10 or sometimes before. The hope is that we are doing this screening to confirm that all is well. But when an issue is found, it allows us to change course and hopefully give that dog many more years. I'd like to share a case example of a senior dog whose life changed by the findings on screening blood work. In her case, her senior blood work was normal just a couple months ago last fall. She was scheduled for a dental cleaning, and so blood work was repeated prior to anesthesia. This is my friend Bella, and Bella is here today because I'd like to talk a little bit about senior blood work and the importance of it. And so you can see she's got a prematurely grayed muzzle, so she is what we consider a senior dog. She's only 10 and in great shape. But her owner elected to do some pre-surgical blood work about a month ago, and on that blood work we saw very mild elevations in her liver values, and I'll kind of show those here. You can see they're not significantly elevated. You know, when we start talking ALT, we start worrying about that up in the levels of 5 times normal, 10 times normal, and we're just a little outside of normal with her blood values. And so it was elected at that time before proceeding with the dental procedure to do an ultrasound and see what she had going on in that liver. And unfortunately, there was a tumor that was noted in the liver. And so from there, we proceeded to do a CT scan to kind of see if we could determine if that was surgical. And here I'll show you the CT scan. So we're going to take a look at Bella's tumor here, and for point of reference, she's laying on her back, so her spine and her back is here. This is her heart, and so the chest, we're going to come back through her chest into what is, so the diaphragm right into the liver. And so the area of concern within the liver, I'll highlight here, is right here. So this dark area within the liver is where that tumor was. This spot here is just the gallbladder. And so you can see as I kind of scroll through, we're taking like little slices through that liver, going back and then forward. You can see how much space that tumor took up, and hence the radiologist being worried that it was removable or not. And so after we got the results back from the radiologist, he felt that potentially it was not surgical and that was going to be too big. And so we had a very dedicated owner that didn't want to completely accept that as the answer, and willing to push a little bit further. So we did reach out to the surgeon, who took a look at the CT and thought that it was worth giving a try and that he would proceed if it was his dog. And so last Thursday, Bella underwent surgery to remove a significant portion of her liver. And as you can see, it's Tuesday, so we're less than a week later, and she's happy. Doesn't want to be here in the office with me, wants to investigate why everybody's having fun out there. But I think it's important to note that had her owner not pursued the pre-surgical blood work or the senior blood work, that we would have missed this, and we wouldn't have pursued, the advanced diagnostics and found the tumor, and likely, it would have been inoperable if we would have waited for her to develop symptoms of that. Now the hope is, because a lot of these liver tumors are benign, that she'll go on to have a healthy, happy life and have years left watching the family, and as you can see here, scrounge around looking for food and table scraps. A couple of weeks have passed since Bella's surgery, and I'm happy to report she continues to do remarkably well. The histopathology came back on the tumor, and it was a cancerous tumor, but thankfully the surgeon was able to get it all. In addition to the tumor, he took biopsies of other lobes of the liver as well as lymph nodes, and they were all clear. This is hopefully a case where surgery could be curative. There's no need with this tumor type for chemotherapy, and Bella will have a need for increased monitoring about every 3 months for the next year, and then every 6 months thereafter. I realize that not everyone can or would want to go to this level of care. Too often in this world, we think everything is black and white and our answer is the only answer. While I have pursued the highest level of knowledge and skill within my profession, I understand that not every one of my clients will be able to afford or want to go to that in-depth level. There is a reason they say that it's the practice of medicine and that it's an art and science. Each patient and owner should be treated as an individual and a plan for that unique situation formulated. I'm always going to offer the path that I think is the optimal path, but then we'll have a discussion on the path or paths that might fit your situation the best.